I'm thrilled to be participating in Destination Education. It's an absolutely fabulous venue and has been a great 24 hours so far. What I am speaking about, the title of my course is Sex and Oral Health, What's the Connection? I know it's gathered a little bit of attention because of the title, but really what I'm talking about, my main critical message, is the fact that there is a huge, distinct knowledge gap right now. There is a new profile for oral cancer and oral pharyngeal cancer that has actually gone up 225%. And, you know, we all think of that older male that, you know, is maybe 60 years or older, heavy smoker, drinker, and that profile is actually decreasing where the HPV or the sexually transmitted profile has gone up. It's just skyrocketing, as I say, about 225% with recent data. So my mission, my passion here is to teach dental professionals how to recognize some of those really subtle signs and things that would lead us to much earlier discovery and essentially, without being over dramatic, but really saving a life, which is what it's all about. Well, I think, you know, there's a number of ways that we can approach it, and we don't have to go right into the whole lifestyle and sexual behavior, but I think we really, really need to communicate to our dental patient today that this profile is changing, and we can preface it by saying we now know. We now know that smoking and alcohol is actually not the main cause of oral cancer. It's a new type of cancer that is transmitted by a virus. And the other thing that I do share in my program, there are a number of resources, educational resources that are available to dental professionals that can help kind of bridge that gap between communicating the message and not, you know, getting into an uncomfortable, awkward position with the patient. Huge, huge. The team has that opportunity when they understand the critical role that the clinician plays in earlier discovery. They have that opportunity to really communicate to the patient. And when there's that strong belief system, like let's take a look at the dental hygiene appointment, for instance. When the team really understands, the business team and all the way through the different aspects of the practice, when they truly understand the critical nature of that dental hygiene appointment that does involve that oral cancer screening examination, they're able to really enthusiastically promote it. So our business team, God bless them, they need to hear this message as well, because if they've got it, they've got that opportunity to articulate and get the message out, get the enthusiasm started, get the commitment from the patient, and be able to support the clinical team and vice versa. Well, I think what we have to realize first is that there are a lot of obligations being a healthcare professional. Society rewards us, they revere us as being a healthcare professional, and society puts their life into our hands. We need to accept that responsibility and take that upon ourselves to recognize that in that whole integrated healthcare system, we are the eyes, we are the hands, the first ones to be able to really recognize earlier discovery. That's our responsibility. So at the very minimum, once a year, a good comprehensive head and neck examination. And what I'm going to teach in my course is curriculum. It's not there yet, especially with this new profile. We're just not there yet with what we're teaching. So it's through my conversations with colleagues that are oral medicine pathologists and oral surgeons that I've had an opportunity to learn new ways to more earlier identify some of these atypical, which are now becoming the emerging pandemic of this new profile of oral and oral pharyngeal cancer. So I'm excited. I'm really excited and very, very thankful. I am going to intertwine two or three very moving stories. One is a great good news story, and the other one is a loss of a very, very close family member in the prime of her life. If I could encapsulate into one message, it would be: don't ever miss the opportunity to save a life. Don't ever miss it. and the ability to save a life is something that when that patient comes in years and years after, and their family members come in, the gratification and the fulfillment of what we do each and every day, I can't even put it into words.